Ninth meeting of the House Standing Committee on Banking and Insurance to order. Madam Secretary, please call the roll.
Representative All.
Here.
Representative Bentley. Representative Bray. Representative Duval. Representative Fraser Gordon.
Yes.
Representative Gooch.
Here.
Representative Justice.
Here.
Representative Lewis.
Here.
Representative McPherson.
Here.
Representative Rorix.
Here.
Representative Roberts. Representative Rudy. Representative Smith. Representative Stevenson. Vice Chair Lockett. Vice Chair Pollock.
Here.
Chairman Meredith.
Yes, ma'am. We do have a quorum and are duly constituted to do business. We are going to start with House Bill 742. But as you all move towards the table, just a couple of housekeeping items I would like to do. This will likely be our very last committee meeting of the session. I want to say a big thank you to our staff for the committee, Ms. Jessica Sharp, Ms. Brianna Patterson, Ms. Liz Hardy, and all the others that have worked with us this session. And we want to say congratulations and good luck to Ms. Liz as she moves on to a new opportunity with the Kentucky State Police as well. This will be one of her last days with us as well. So we appreciate your work over the time that you've been here and wish you the best of luck. I also do want to take an opportunity. I think Representative Justice has some guests with him, and I know he would like to introduce them.
Thank you, Chairman. These are my three kids. I have my oldest daughter, Ava. She's a volleyball star. And my second daughter, Elena. She's cheering and softball. And then Jude is like his dad. He's a feral hillbilly. So I told him whatever he does on a regular day basis, do the opposite while he's here, and we should be good. So make them feel welcome. Thank you, Chairman.
Do any other members of the committee have guests they would like to introduce? All right, seeing none, those of you all who are here, Representative Sharp, if you would introduce yourself for the record and let your guests introduce themselves as well.
Thank you,
then
Mr.
you
Chair.
all may proceed.
Thank you, Mr. Chair, committee members. I'm Representative Scott Sharp from the 100th District.
Good afternoon. My name is David Snyder with the American Property Casualty Insurers Association.
And Chris Nolan with the Insurance Institute of Kentucky, in which the APCIA is a member.
Thank you. Last year we passed House Bill 236, and it was to tighten up the pension funds and the fiduciary requirements that are going on with our pension funds. Specifically, is what it has done is it's taken politics out of the pension funds for our state employees, and it directed the pension fund managers and the proxies to only vote on a financial return and not on any other political factors. Now, what we're doing here with 742 is it's going to tighten up the proxy votings and accomplish one goal. It requires, if a proxy advisor is going to vote to make recommendations which is not consistent with the company's independent board of directors, the proxy advisor must conduct an economic analysis showing why the recommendation is in the best interest of the company, and thus the best interest of the Kentucky pension system members. So this is just strengthening up the bill from last year. And with that, I'm going to pass it on down to Mr. Snyder.
Thank you very much, Mr. Chairman and members of the committee. Thank you for the opportunity to visit with you this afternoon. As the sponsor quite rightly indicated, the new language in this legislation is entirely consistent with the intent and language that you enacted last year, that the pension fund should operate purely on pecuniary and financial grounds and for the best interests of the beneficiaries and members. So the new language is just simply a tool to carry out that intent and that clear legislative direction. If a proxy advisor gives advice consistent with an issuer's board decision, then it must establish that there's a pecuniary basis for that.
Motion on the bill.
We do have a committee substitute that we need to adopt first. Have a motion on the committee substitute from Representative Rudy, a second from Representative Pollock. Just so that everybody understands, this sub is what they have been explaining already. The other bill had different language in it that was gutted, and this sub was replacing that, and so that's what they have already explained here. Any questions about the subs before we adopt the sub? Seeing none, all in favor of adopting the sub say aye. Aye. Any opposed? The sub is before us. Do you have more testimony?
Move passage of the bill as amended by the sub.
All right, so I have a motion from Representative Frazier Gordon, a second from Representative Rudy. Any members that have questions about the bill? Seeing none, Madam Secretary, please call the roll.
Representative All.
Pass.
Representative Bentley. Yes. Representative Bray. Yes. Representative Duval.
Yes.
Representative Frazier Gordon. Yes. Representative Gooch.
Yes.
Representative Justice.
Yes.
Representative Lewis.
Yes.
Representative Lockett.
Yes.
Representative McPherson.
Yes.
Representative Pollock.
Yes.
Representative Rorix. Representative Roberts.
Pass.
Representative Rudy. Aye. Representative Smith. Yes. Representative Stevenson.
Pass.
Chairman Meredith.
Aye. Vote does pass with favorable expression. 742, as amended by the committee substitute, is adopted. Same shit on the House floor. Thank you, gentlemen, for being here, and thank you for your testimony.
Thank you.
Thank you, Mr. Chairman.
Next, we have Senate Bill 188. Senator Wise, if you want to come to the table, introduce yourself and your guest for the record, and then you all may proceed.
Thank you, Mr. Chairman, members of the committee. Max Wise, State Senator, 16th Senate District.
Representative Danny R. Bentley, District 98 of the Great Commonwealth of Kentucky.
My name is Ben Mudd, the Executive Director of the Kentucky Pharmacists Association.
Please proceed.
Thank you, Mr. Chair. Members of the committee, what you have before you is Senate Bill 188, which I'm sure none of y'all have heard from your hometown independent pharmacist about this bill or your constituents back home, because I've heard from many of you all asking me when this bill would be in your possession. I want to thank you, Mr. Chairman, for hearing this bill today as we passed it off in a nearly unanimous decision off the Senate floor in a very bipartisan, supportive manner. Really quickly, here's what the bill does. As it relates to community pharmacies, we follow the lead of surrounding states of Tennessee and West Virginia to protect patients and community pharmacies against predatory PBM practices in the commercial market. Many of y'all voted on before, if you were here, Senate Bill 50 a few years ago that dealt with the Medicaid side. Today before you is on the commercial side. Senate Bill 188 contains some very basic principles as it relates to the PBM, specifically Representative Pollock. It will prevent the PBMs from requiring Kentuckians to receive their prescriptions by mail. It will reimburse a pharmacy they own at a higher rate than a community pharmacy. It will steer Kentuckians to a pharmacy that they own. It will prohibit a community pharmacy from filling a 90-day script for a maintenance drug while only allowing that amount to be filled by a pharmacy owned by the PBM. It will also prohibit a PBM from requiring a Kentuckian to pay a higher copay at a community pharmacy than they would have paid at a pharmacy owned by the PBM. And also it would prohibit the PBM from penalizing a community pharmacy for sharing information with the Kentuckian on the cheapest option to pay for their medications. The bill will require, though, a PBM to include community pharmacies in their network to ensure that a Kentuckian will have the option to purchase their medication from a pharmacy within 30 miles of their home. It will also require PBM to pay a fair dispensing fee to pharmacists, submit their plan offerings to the Kentucky Department of Insurance to ensure compliance with this legislation. And lastly, we did have a committee sub, and we had a floor amendment on the bill as it's presented before you today. The bill will now only use a Medicaid reimbursement rate as a floor for the independent community pharmacies, and that Medicaid rate will only be a temporary stopgap and will be replaced by a rate established by the Kentucky Department of Insurance based on a cost of dispensing fee that the DOI will conduct in an expert economic analysis. At the request of insurers and PBMs, the white bagging provision was removed from the original piece of legislation. Medicare Part D plans have also been specifically exempted from the legislation. Language has been included to ensure that only a fair small portion of this bill will apply to ERISA plans. And while DOI will set a new floor price for brick and mortar pharmacies, the floor amendment ensured that the price floor does not apply to mail order pharmacies, which allow employers to encourage their employees to use mail order should it be a cheaper option for those employers. Lastly, the bill originally said a PBM must contain a pharmacy in network within 30 minutes or 30 miles from a Kentuckian's residence. We changed that on the floor of the Senate yesterday to delete the 30-minute language. I would like to allow if my guests wish to make any additional comments for this, but I would guarantee that each and every one of you up there in the last couple of years have had a hometown pharmacy closed in your hometown or your community. This bill stands for small businesses in the Commonwealth of Kentucky. Thank you, Mr. Chairman.
I do have a motion from Representative Roberts, a second from Representative Lockett. We do have some folks who have signed up to testify against the bill, so we need to give them their opportunity. Representative Bentley, would you like to say anything before you leave the table, though? Connor Rose, Hope McLaughlin have both signed up. If you all will come to the table, introduce yourselves for the record, who you represent, and then you all may proceed with your testimony as well.
All right, good afternoon, Chairman, members of the committee. My name is Connor Rose. I'm a Senior Director of State Affairs at PCMA, or the National Trade Association, representing pharmacy benefit managers. Our members administer prescription drug benefits for over 4 million Kentuckians who receive their health care through their employer, insurer health plan, state-sponsored program like Medicaid, Medicare Part D, or union plans.
Hi, I'm Hope McLaughlin, and I'm with Anthem Blue Cross Blue Shield of Kentucky. Thank you.
Great. We appreciate the opportunity to speak in opposition to this bill. We've had this discussion in several committees over the last few years, but I think this legislation comes down to one fundamental question, does the entity or person paying for the cost of the benefits they're providing? So employers, large, medium, and small, city and county governments, unions, even the KEHP, do they have the right to maintain control over their benefit plan, how it's designed, how it's paid for? And this bill effectively says no, they do not have any control. There's three things I'd like to just quickly hit on regarding the legislation. So first is the dispensing fee. So if this bill were to be enacted, independent pharmacies will be paid $10.64 per prescription dispensed in the state, while the Department of Insurance is figuring out what dispensing fee they'll establish. Again, this bill is specifically designed to benefit independent pharmacies. However, whatever dispensing fee is established by the department is going to be paid to corporate chain pharmacies. So my question is, why is a bill designed to help independent pharmacies going to require employers, city, county governments, and ultimately consumers to pay more money to Kroger, Walmart, Publix, etc.? Secondly, we've heard Senator Wise mention the floor amendment fixing some issues around ERISA and what may or may not apply to ERISA plans in this bill. And those ERISA plans are large and small employer, or large multi-state employers, unions. And the fact is, groups representing those employers and those types of plans do not feel confident that those proper exceptions and protections are in the legislation. Aside from any amendment, the fact is the dispensing fee mandate and the reimbursement floor apply to those plans, and they have expressed concern with that and the impact it will have on their benefit plans throughout this process. And finally, just generally speaking, and there's plenty of specifics in this bill to go on about, but in short, this bill prohibits plan design options that allow consumers to pay less to use pharmacies that cost the plan sponsor paying the majority of the cost of the benefit less money. And it's frankly solely because a pharmacy may be affiliated with a PBM that these plan design options are eliminated, and these are options that are proactively selected by the people who hire us in the RFP process. I would also point out that while those plan design and options are limited or eliminated, this legislation exempts self-insured hospitals and health systems and university student insurance plans that own pharmacies. So while they are allowed to steer their beneficiaries to their pharmacies ostensibly to save money, nobody else can. And again, these plan designs, whether it's incentivizing mail order pharmacy, which demonstrably saves money, incentivizing the use of affiliated specialty pharmacies when we're talking about hundreds of thousands of dollars, drugs that cost hundreds of thousands of dollars, making sure the right person gets that drug at the right time from the right place and is able to have high-touch clinical engagement throughout the course of that treatment are critically important. And all of those tools and controls are going to be eliminated from employers, city, county governments, and consumers will ultimately be paying more because of it.
Thanks, Connor. Chairman Meredith, members of the committee, thank you for the opportunity to offer some comments on Senate Bill 188 today. In working with our customers, which are large and small businesses across Kentucky, our primary goal is to deliver high-quality, affordable care. Connor mentioned Senate Bill 188 proposes a mandatory rate of $10.64 per script, which will result in significant additional health care costs. And the value that we provide to our employers, to the employers that utilize our networks, is really the ability to drive discounts. Setting rates in statute, or in this case, a recurring rate setting process by the DOI, undermines that private market function and sets a dangerous precedent of putting the General Assembly and the executive branch in the role of setting provider reimbursement rates. We can all agree here today that the price of drugs is a concern for many. Pharma sets those prices, and it's our job to negotiate to get the lowest price possible for our customers and our members. We work with those businesses to develop benefits tailored to their needs, including in the pharmacy space. There is nothing in this bill that lowers the cost of drugs for consumers. Instead, this bill limits the tools that our customers choose to keep those prescriptions affordable, like incentivizing mail order. A vote for this bill will be a vote to add direct cost to the price of every Kentuckian's prescription. In Kentucky, about 67% of businesses are self-insured, so this will be an increase directly to those businesses and their employees. These are not Anthem dollars. These are the dollars of those businesses and the consumers that are paying for their prescriptions. You know, I work with you all a lot, and I know that I'm not going to change a lot of hearts and minds here today, but I'm going to be back next year and continue to work with you all every year, and I feel like it would be a disservice to the process and also to our customers if I didn't point out to you that there is no fiscal note on this bill. There has never been a fiscal note made available to the public, and there's no health mandate statement that has been made available on this bill. This committee and Mr. Chairman, you have been an advocate of how valuable those health mandate statements have been. And, you know, KRS 6.948 states that any bill that has a health mandate in it, including a specific rate that is required to be paid to a provider for a health care service, is required to have a health mandate statement on that bill developed by the Department of Insurance before it moves forward off of the floor or even out of committee. This bill doesn't have that, and we have never seen any of those evaluations on the bill. And it has a very real impact on the state budget, local governments, universities, and a variety of businesses in Kentucky. So it's important to me to point that out to you today and hope that as the bill goes through the process, that evaluation will be conducted so this body, the voters, businesses, and consumers know what the impact to healthcare premiums is going to be moving forward. And, you know, we want to make sure that we maintain the integrity of that valuable process and encourage you to vote no on the bill until we can have that full evaluation and you know what is sitting before you. Thank you.
Thank you all. I do want to clarify, we do not have the health mandate in the folders, but the members do have the actuarial analysis from KEHP and the local mandate statement. I think the sponsor may have the other analysis as well. I don't know if he wants to come up and rebut any of that testimony. You have that opportunity, and we do have some questions from members of the committee as well.
Thank you, Mr. Chairman. I will say in one of the comments, when we look at government getting into the role in the free market, at what point, though, do we sit back and watch as private business owners of small businesses close their doors? When we see dispensing fees for the Kentucky Employee Health Plan, they're at 15 cents for those dispensing fees. And while I think in here we all would believe that we need to allow the free market and capitalism to work, we also see at times where there's unfair business practices that are occurring. That's what is happening with the PBMs. Some of y'all in here are pharmacists. Some of you in here are small business owners. Some of you here are just representatives representing your people as constituents. Once again, this bill is to give patients choice and to help those business owners not succumb to unfair business practices that are occurring, for them to be able to go about their daily lives, provide a service, and at the same time help in their hometowns when they come to ask for help and support with community projects, and seeing that those businesses are being closed and shuttered down. As it relates to the fiscal note on the impact of that, I would like to allow Ben Mudd with Kentucky KPHA to speak specifically to that. You have the letter in front of you that's presented there by the Personnel Cabinet and the fiscal analysis that was done on behalf of the Kentucky Employee Health Plan, specifically as it relates to that.
Thank you. So the fiscal impact statement from DOI this is on the bill as amended by the committee substitute. It showed that there could be an increase in premiums from 0.2 to 3.3%. It also notes that unfortunately there's a lack of available and reliable data regarding PBM contracts, which we've said time and time again. There is no transparency, so there is no way for them to get that information. I would note that this is approximately a 75% decrease from the original analysis that was done, based off the language to apply the 1064 to independent pharmacies only in the first 2 years of implementation.
Mr. Chairman, if I could allow Representative Bentley.
Just very few. I owned an independent pharmacy for 20 years, and one day someone come in and gave me a contract and said, you can take it or leave it. So the mandate was given to me. To take care of my community, I had to take it, because I took care of my community, and I figure I saved my community at least $60,000 a month just by taking care of people right. Number two is on ERISA. ERISA, if you look at the Supreme Court in Oklahoma and Arkansas, they've already agreed with their decisions that ERISA law won't allow it. Then they're saying that they don't agree with Arkansas and Oklahoma. And I had one other idea. I'm getting old, I forgot it. That's enough, I think. Thank you, Mr. Chairman.
Thank you. Like I said, do have some members with questions. We will start with Representative All.
Thank you, Mr. Chairman. I've got two, if I could, real quick.
Go ahead.
There was somebody mentioned Kentucky Health Employee Plan in one of the testimonies and comments, and we've got the letter here from KTRS that says some of their membership is excluded or exempt from this bill, and I've been told that by others, so I think that's true. Specifically, how would this bill, as it's proposed here in front of us, affect KEHP members who are not yet 65 but are already retired or are already in the system who would be eligible to retire before they hit 65?
Representative involvement allow. Dr. Mudd.
Yeah, so that they would, those folks are on the same plan as the KEHP. Everybody's in the same system until you turn 65. So those 65 and older would be excluded from the bill altogether. So the retired teachers that are between retirement and 65, they would be subject to whatever happens to the state employee health plan.
So, they would likely incur some increased cost.
Yes. The analysis came back that it could be plus or minus about $15 million. So they could see savings from this, but there was a range that they gave on that document. So it could, if we look at what we saw with Senate Bill 50, it actually had a cost avoidance. I think the opposition would note that there was a per member per month increase, which was true on Senate Bill 50, but the analysis came back and said we avoided saving more money than we would have, and the reason being that there in that time frame there were several drugs that came to market that were very expensive. So if we look at Senate Bill 50, it saved this. It had a cost avoidance, but the PM did go up over that time.
Representative Hall, just want to also add on the last page, you may see there on that letter, it talks about the best case financial impact of the bill of the rebates could be at the $15 million, which Dr. Mudd is specifically talking about there.
So this is passed in 40 some odd other states. Have they seen savings, or do we know that age range there, how it's affected them in those other states?
I don't think it's passed in that many states. Probably, we know that it's passed in West Virginia, Tennessee, and Arkansas, or similar provisions. And the years following implementation, those states did not see an increase in premiums that was higher than the national average. In fact, in some of those states, they had a lower increase than the national average.
The second question is on the health mandate statement. I've had people send that to me. Do we have a health mandate statement that's available?
Go ahead.
I do not have that at this time.
Is there one? I guess that's the question.
Dr. Mudd?
I believe there is one on the LRC's website, but let me confirm that.
I do not have one here with me at this time. But in terms of that being requested and being done, yes, it has been done. Correct.
It has been done.
Yes.
It's just not available to members of the public.
It should be available on LRC's
It's on the
website.
LRC
Yes.
website. Could somebody point us in the right direction where to share that? Because I'm being told it's not. So, and it doesn't have to be right now. After committee, somebody could share with that so we could get it around to folks. That'd be great.
Tell you what, let us come back to you if we can
That'd
of
be
what
great.
we're looking up right now at this time. Thank
Yes,
you.
sir. Thank you.
Representative Justice.
Thank you, Chairman. I would like to ask a few questions and speak on the bill. So, Senate Bill 50 kind of condensed down to 1 PBM for the state workers, correct? So that demonstrated, I think, kind of the potential of this type of legislation, and it avoided 200 some $200 million in the cost avoidance for the state.
Like 282 was about that rough
closer
number.
to 3.
Yes. Yep.
So you can just imagine what it would do, statewide. And I want to thank you guys for this legislation. I think Senator Wise, this is your 5th pharmacy.
It's been
Something like that, Bill.
It's been, yeah.
Probably the hardest fought and most impactful, I would say. And Representative Bentley, a mentor of mine, he practiced for 51 years. Is that correct?
50.
Yeah. So I think he knows what he's talking about, and I trust his opinion on this. Doc Bentley, Representative Bentley, is passionate, and like me, practices healthcare in rural eastern Kentucky, where it's a lot harder to kind of survive and prosper in every way, socioeconomically. But it's our home, and we're glad to do it, and we do it willingly. So this legislation not only, in my opinion, benefits Kentucky patients, it also, oftentimes those patients are the most vulnerable population. It also protects the pharmacists, the hometown small businesses, the guys that are putting their names on the back of your son's or daughter's Little League jersey. And I have a pharmacist that's been blowing my phone up every day about this. And he has 3 pharmacies throughout my district. And 2 of them, I would say, are on life support. And without some type of legislation like this, there definitely will be closing. And we've already closed 3 pharmacies in my district since the beginning of 2023. So I think this is a very important piece of legislation, and I'll be happy to support it. Thank you, guys.
Thank you.
Representative Smith.
Thank you, Mr. Chairman. And first of all, thank you, Senator Wise, for this piece of legislation. I've talked to my pharmacists over the last few years. It's been on the radar since I've been up here for 3.5 years. And Representative Bentley, thank you for being a mentor on this type of policy. But I want to speak on the legislation. If we can't pay attention to fire alarms, I don't know what we're going to pay attention to. And if we can't pay attention to our professionals at home, I'm talking about our independents. I'm not talking about big box. They move them around. They may be from Virginia, Tennessee, the pharmacist may be. I'm talking about our local pharmacies. If we can't listen to them, then we're tone deaf, Dr. Bentley. We've got to listen to our local pharmacies. It wasn't 15 years ago, I went to a back doctor in Ohio that I was sent to, recommended, and he gave me a script. And he gave me a script for 90 Lorcets a month. I went home, my pharmacist come to my window, who I've known all my life, and he said, Tom, I'm not feeling this. And I said, do what? He said, I'm not going to do this to you. He said, I'm going to give you 5. He said, when the pain comes on, take 1. And he said, go see another doctor. And it come to find out it was my hip that was bad. And I had a hip replacement. My pain, my sciatica went away. I said that to say this. I depend on my local pharmacist to also advise me. And there are friends. And when they call me and tell me that they need help, that's when I think we need to stand up. We better start listening to our local people. And thank you, Dr. Bentley, again, or Representative Bentley. Thank you, Senator Wise, because I know it's right, or my pharmacies wouldn't be contacting my pharmacist, my professionals. So thank you again.
Mr. Chairman, if I could go back to Representative All's question that Dr. Mudd has got.
It is not on the website, but there is a fiscal impact statement from DOI. Happy to share that with the committee members and with permission from the sponsor. It can go on the website. But that's what I was speaking to when I gave the percentages earlier.
If you all can get that to us, we will disperse to the committee members and get it loaded to the website.
Absolutely.
Any other members have questions at this time? Taking a little bit of chair's privilege, I want to echo what my good friend Representative Smith said. In a lot of these rural communities, and I come from a very small rural community, it's my hometown. For many years, it was the pharmacist that was your frontline healthcare provider, more so than maybe a doctor or otherwise, because we had such a shortage in those rural communities that the pharmacist was picking up a lot of slack in those areas. And so I understand the need for this and appreciate you all bringing the bill. We do have a motion and a second. You got a question? Representative Lockett has a question.
Thank you, Mr. Chairman. I just have a quick question for you. I think this was a reference before, and this is strictly just for my information only. And it's on page 8, I guess section B, subsection 2. It talks about shall not be less than $10.64. Can you go into more detail about what that is, what that means, and how'd you get to $10.64?
Yes, thanks for the question. So that is the cost of the dispensing fee that's paid by Kentucky Medicaid right now to pharmacies under their model. And so that's where that number came from. But that will be replaced by the dispensing fee that's determined, the average cost to dispense a prescription drug in Kentucky once DOI does their study, which is required by the bill. But the 1064 came from Medicaid.
Representative Lockett, that's exact. When we went back on Senate Bill 50, that's what we did. I think we took it from $2 and so much change up to that level when we did Senate Bill 50. And as Representative Justice said in his question or comments, $282 million were saved in the Commonwealth of Kentucky for taxpayer dollars by us doing what we did to Senate Bill 50. And I would almost say we probably have gotten more savings than that have probably came out because of that. And we're doing the same exact thing of doing this on the commercial side with raising that. However, I will say with that DOI cost analysis study, there's a chance that comes back and it could be lower than 1064. that's where it would go into place. Just and make sure being all transparent with what we're doing here. We have it at that rate right now, but if that economic study comes back and it shows it's at $8.50, that's where it would be at.
And if I may, Chairman, the 1064, when you're in business and independent, that's the cost of doing business. You have an inventory that you have on your shelf. You have employees. You have everything that any other business has. You got to keep the roof over it. You pay your insurance. You pay your utilities to the city. You pay all your license. You pay your DEA license. That's the cost of doing business. And so that's where a lot of that came from. And I started in 1995 working on some of these problems with the National Community Pharmacists Association. National Community Pharmacists Association always showed also that there would never be any premium increases if we did this. So I've been there, I know, and that's what that 1064 is about. My prediction is it'll be higher than that when it comes back, because I went to one person who I can't mention, and we went through 1 million prescriptions, and it came back $11 and something. So there is a cost to doing business, and that's what it is. Thank you.
Representative Stevenson.
Thank you, Mr. Chair. Thank you, Senator, for bringing this bill forward. I have received a lot of communication about it, a lot of people asking for this bill. And the one thing I would say is that I don't think it goes far enough. I think that, there's a lot of people out there that are really frustrated right now because PBMs are making them jump through extra hoops once their doctor has prescribed something to them and the doctor and patient relationship has decided that that is the path they should go on. I do not think it's fair for PBMs to come in and say, well, okay, you can have what your doctor thinks is best for you. However, we need you to jump through these 10 extra hoops in order to do this or to keep your prescription. And I'm hearing a lot about that. So I'm hopeful that next year maybe we can come back and address some of that. Thank you.
Thank you, Representative. And I will say I want to give hats off to the entire General Assembly. We've done phenomenal pharmacy work over the past few years. And we've become a state model in a lot of this. I will tell you, some people will look at Arkansas, they may look at Louisiana or other states, but Kentucky is also in that conversation of things we've done over the last 5 to 6 years. So it's a tip of the hat to each one of you all and the members of this General Assembly for passing legislation and also showing that this is a state where we're going to stand up to unfair business practices by the PBMs. Thank you.
Any other questions or comments from members of the committee? Speak now or forever hold your peace. Seeing none, Madam Secretary, please call roll.
Representative All.
I'm going to briefly explain my vote.
Go ahead.
I'm going to vote yes because I know we've got to do something. I don't know exactly what the right answer is, but I know the definition of insanity is doing the same thing, expecting a different result, and we're seeing too many of our small pharmacies, mostly in rural Kentucky and even in some bigger cities, go out of business, and there's got to be something done. I don't know if this is exact right thing done, but we've got to do something. And so I'm a yes today, and I'm hoping we can come back next session and make things better. Thank you.
Representative Bentley.
Yes, ma'am. In 1968, I wrote in my high school annual I wanted to be a pharmacist. At that time, you could make 25% gross margin. Today, about 3 to 8 gross margin. After Medicare Part D, mine fell 8%. So they're just surviving. We need this bill, and thank you. Mine is a yes.
Representative Bray.
Aye.
Representative Duval.
Speak on the bill. Senator Wise, Representative Bentley, thank you for this outstanding legislation, and thank you for the countless hours that you've spent making this a very effective bill for our Commonwealth. Thank you, and yes.
Representative Frazier Gordon.
Yes.
Representative Gooch.
Could I explain my vote?
Go right ahead.
Thank you. Thank you, Mr. Chairman. This is one of the things that I hate to do more than anything. And then for 30 years, we in the legislature have been interjecting ourselves in between the contractual disputes of 2 or more parties, whether it be insurance companies and doctors and pharmacies or whatever. And I don't like doing that. And it shouldn't be that we have to do that. But there does seem to be some instances where PBMs have maybe participated in what very much seems to be unfair practices that does put some of our local pharmacies in jeopardy. But I will say that in my hometown, I have heard from one of my two local pharmacists, but it wasn't them. It was 2 years ago, the CVS store is the one that went out of business. So for whatever reason, it happens both ways. But I do have respect for the sponsors of the bill, specifically Senator Wise and Representative Bentley, and I am going to vote yes today.
Representative Justice.
Yes. Explain my vote.
I just want to, again, thank you guys. This is very important, and I won't be here next session. And this has been kind of, in my opinion, a monumental year for healthcare in rural Appalachia, whether it's certificate of need, the 280 that we did the other day, and now this is just as important. So I'm very protective, and I want to ensure the longevity and access to healthcare in these super rural, underserved communities. So thank you guys. And yes.
Representative Lewis. Yes. Representative Lockett.
Yes.
Representative McPherson.
Yes.
Representative Pollock.
Yes.
Representative Rorix.
Yes.
Representative Roberts.
Yes. Explain my vote.
Go right ahead.
Thank you. What I wanted to say is, Doc Bentley, thank you so much. It occurs to me as the days are waning now that this may be one of your last times at the table, and what a poetic end to a career well held. Thank you.
Representative Rudy. Representative Smith. Yes. Representative Stevenson.
Yes.
Chairman Meredith.
Yes. Senate Bill 188 does pass with favorable expression. Same should on the House floor. Thank you all very much.
Thank you, members.
What's that? Yes. Representative Rorix would like to record a vote.
I would like to record my pass vote on House Bill 742.
We have no further business. Do I have a motion to adjourn?
Motion.
Got a motion, a second.